ROS? ROS, similar to FSS, is HUD's opportunity to give public housing the opportunity to apply to request funding to hire a ROS service coordinator to pretty much do the same thing that the FSS coordinator is doing. Assist the participants to identify goals, personal, professional, private goals, and help them to overcome any barriers that they're having to achieve those goals, right? By linking them to programs and community partners and services to help you to achieve self-sufficiency. So that is the purpose of ROS, Service Coordinator. ROS is for 3 years, unlike FSS, which you have to apply for it every single year. ROS, once you get awarded this year, you sit pretty for another 3 years. You don't have to do anything. You get your money every single year. When 3 years comes around, then it's your renewal. And once you're a renewal applicant, it's fairly easy to get awarded again.
Okay.
Eligible applicants for the ROS program are public housing authorities with traditional public housing units, not under a CHOP, not converted to RAD. Also, nonprofits can apply. Nonprofits with a 501c3 letter from the IRS, and nonprofits without a 501c3 letter from the IRS. They're recognized at the state level, a state level certification that they're a state level nonprofit. Tribes can apply. Their housing, Native Indians housing entity is called tribally designated housing entities, unlike public housing, so they can also apply for the ROS. And resident associations can apply for ROS. So resident associations, if they become legally formed, they can apply. And I'll tell you something else, resident associations get priority funding over any other applicant. And why do you think that is?
Because they're resident.
And in addition to that, because HUD wants residents to be more active in public housing, they'll give them the money. Here's the money, just be active, stay formed, do. So the things that this ROS program does, if the residents form together, apply for the grant, hire themselves a ROS service coordinator to help them, they literally give them the money. It's so easy. So easy, I mean, if you do it, you're supposed to, but because they get priority funding, it's really super easy.
It is. So just like I said, we're looking to hire a self-sufficient person, so they can apply for this ROS.
This is the one you should apply
for their program. And plus, if they come and teach at our housing authority, can residents still apply for it? So that's.
You have to be a resident.
Yeah. Do you have an organization? Do you have a resident?
We're putting one together now.
So it has to be it has to be legally done.
Yeah, we do the election legally.
We actually, my resident council is a 501c3. So they have, it's governed about a board and everything. So you have to have that in place. That they I don't think they have to be a 501c3, but they have to be legally organized.
Yes. So what I'm saying is, can the residents have their ROS and the nonprofit that comes to
every
teach them?
housing authority can get up to 3 ROS grants if you do it. If you're strategic about it.
Yes.
Yeah. Right.
So any of these applicant types can propose to serve your public housing units and go in. So so your housing authority can apply for one, the resident association can apply for one, and a nonprofit could apply for one.
Can we have this? Can you email us these slides?
Yes, definitely.
I have the.
Oh, you have the email list? Okay, awesome.
Yeah.
Of all these applicant types, only nonprofits can get 3 awards. So a nonprofit can get 3 separate awards. It's crazy, but I'm pretty sure it's some loophole, but a nonprofit can get 3 separate awards. A resident association can only get 1 award, and every other applicant can only get 1 award except a nonprofit.
Okay.
Okay, so how do you know how much money you can request? So if you have a minimum of 50 units, you qualify for $245,850. That means you qualify to hire 1 raw service coordinator, which if you request all the other maximums, you qualify for this. If you have 1,001 to 2,000 public housing units, you qualify for 2 service coordinators at $491,700. 2,001 or more qualifies you to hire 3 raw service coordinators at this amount. A nonprofit with their separate applications, because they can submit and get awarded for separate applications, can actually apply for 3 and get $737,550 3 separate times.
Wow.
Wow.
Yes.
So that's per person.
So interesting to note, a very, very small housing authority can apply for Ross and get it, as long as they have 50, which a lot of times that's a nonprofit. I'm so small. As long as you have 50, you can get it. Okay, so a trick question for you. Remember, it's a trick question. How many service coordinator positions can a housing authority request with just 150 units?
1.
3.
You're
PH.
good at math. Why did you say 3?
The month is
1 for the nonprofit, 1 for the PHA.
and 1 for public housing, 3. Yeah.
But everybody thinks, if I'm under 1,000, I only get 1.
That's what I think.
No, if you
That's what-
just put it all in one
Yeah.
application, you only get 1. But if you put them all in different applications,
Oh, wow.
you get
Yeah.
You get 3.
Yeah.
And that's what we did for these.
Okay.
That's why they have multiple awards.
Yeah.
Because they partnered with their resident association here, nonprofit resident association, nonprofit resident association, resident association, just different ways of turning it over so you can maximize the award.
And that money is restricted only to whatever you want to do within that FSS program. Or that Ross program, not FSS, but the Ross program.
Ross allows you to do 3 main things, and they're big. So Ross allows you to pay for the salary of the service coordinator. The salary is up to $72,000, so Ross is capped, which is another conundrum, right? What's the conundrum? Why is FSS not capped and Ross is capped? They're the same program, or they're the same program office, so we'll see how they handle that. Because I'm pretty sure these Ross service coordinators want increases too. So it pays for the salary, which is up to $72,000. Then the training and the travel of the service coordinator, which is $2,500 per year. So once you hire the service coordinator, they can go off to conferences too. Mental health is huge right now.
It is.
Getting them trained on mental health issues, how to and also now everything is virtual. To work with your participants virtually.
Did you say that the travel is capped at what's the amount?
$2,500 per year, because it's lumped in with training and travel.
Okay, it's lumped in.
Yes.
I was just gonna add, and it's not on the list, but I think it's one of the most effective things that we do with some of the funding is I can make grants directly to my residents for childcare, transportation.
Oh, yeah.
From Ross, right? From
Yes,
Ross.
with Ross. And so I'm working closely with people, and as you know, for example, I had a mom who is now on her own and self-sufficient, but a bird hit her windshield. And she was she did not have the $200 to replace that. And she was not gonna be able to go to work, and it was one of those jobs that she was just starting, she would have lost the job. Now, you can do anything and nobody's losing a job. But anyway, but back in the day, and granted, there are churches and local places that we can go for the $200, but it was a perfect example that it was a transportation, you know, and you give the money directly to them. I mean, you have a real relationship. And then, so she could get the windshield fixed immediately and didn't miss a day of work. And then another example is so many of our college kids, these book expenses are horrible, and they're not always covered in whatever scholarship. So sometimes the books get very expensive, but I can really help with those book expenses so it's not burdening our college students. So that's been a great help for us.
Which is one of the reasons I love it so much. Because FSS only pays the salary, and it's every year, just drug along, just asking for salary. Ross does so much more. So the monies that you spend for residents comes out of the annual administrative costs, because they have this administrative cost that you can spend it with. You can buy computer equipment and software and furniture and those things for the service coordinator to set up their office space, even to pay for their rent, because some housing authorities are scattered sites, so they may not have like a central location, so it would be more beneficial for the service coordinator to be at a different place or something like that. So any questions about this slide? All right, so to go back to the previous slide, do you want the...
You have one person.
Oh, go ahead.
Oh, no, fine.
Okay.
I think I worked it out.
Okay.
So, in 2020, HUD had 35 million. They've been having this 35 million for quite some time. Resident associations, like I said, they get priority funding. I highly encourage you to go back and talk to your executive directors to help the resident associations to form, especially my FSS people, so that they can apply for themselves and get a service coordinator. Remember, if you have 3 resident associations formed, those are 3 separate applications, and they can get 3 separate service coordinators, 3 separate $245,000. Because of the 25% set aside, they could actually get 8.75 million. They only got 1.5. They only got 1.1. They only got 3.1. They can get 8. They are not formed enough to exhaust what they could get. In addition to the fact that they can get this 8, if they exhaust the 8.75 and there's still more resident associations left, they go back in the pot again for the remaining 75. That's how much HUD wants to get resident associations funded. So this is the amount of awards that were given out. Renewals got this much. You can see new is not far behind. New is just as funded as renewals are. I will get asked that, we're a new applicant, are we going to get awarded? Almost. You stand almost just as good a chance as renewals do. So don't worry about it. One of the other reasons why I like Ross Service Coordinator grant so much. What does the service coordinator does? Service coordinator, he or she goes in there, works with the residents, does a resident needs assessment, a survey. What are your needs? What are the strengths and the weaknesses? So after the strengths and the weaknesses, to identify the residents' goals and identify the barriers to those goals, and then identify community partners. Ross does not have the PCC like FSS, because for FSS, the PCC is mandated. For Ross, it's not. Ross is a little bit, freer. But reach out into the community and link because those community partners, they're out there. One thing that I know about community partners, they are starving for housing authorities.
Yes.
Because they need to justify their
Yes,
own
Yes.
They're just waiting, and they're not being called by the housing authorities.
Yes.
Just because we're in Georgia, is anybody really involved with their Family Connection Network?
Yes.
Because they're
Awesome.
all service providers,
Yes.
and we go in as service recipients, and
Yes.
you're dying to get in.
Yes.
That's a good point,
They always want
because
to get into the housing authority.
They do.
Family Connection, we get ready to partner with them, because Family
Right.
Connection service 90% of the people living in public housing in Section 8, so why not let that be one of your main partnerships?
Yeah, so true. Create the individual training and service plan, does resident engagement. Why is resident engagement necessary?
Oh, because you gotta know what's going on within the units and their needs, that's the only way you're gonna find out, if you have a great relationship with them.
Build a relationship so they can trust you, so that they can stay in your program. If they're not engaged, YouTube has them, you know? Something else has them. They're in the house, they're at a party, they don't want to show up. Now that we have the virtual interaction, maybe that may decrease it a little bit, because just jump on your computer and have the meeting with me so I can follow up with you. But resident engagement is really, really important. Once I win an award for a client, I'll say, you definitely need a highly energetic, highly creative, this person must be creative and motivated, and understand low-income people. Not someone to come in and turn their nose up at low-income people because why they're low-income or they're disabled or some other reason. But engage them, have fun activities, target what their needs are, and help them. Engagement is extremely important because they've already kind of dropped out of society by living on they have a subsidized way of life. So if they've already dropped out of mainstream society, they're gonna drop out of your program if you don't engage them. And then to provide the supportive services and the follow-up, and then to do evaluation and reporting. So those are the roles of the service coordinator. They have areas of need that they do want you to focus on. Digital literacy is one, education is always a huge one, employment, substance abuse, they want you to help the re-entry population, that's one, and financial literacy, as you know, is a huge one. You guys have a good financial literacy program that sounds good, because you can make the money, but if you're not saving it or keeping it or investing it where it needs to be,
Right.
yeah, this is really smart.
Do any of these programs, like, target military people, veterans who live in public housing or Section 8?
One of the other ones I'm about to talk about called Youth Build does target, like they target in terms of you can prioritize serving them, meaning if you have 2 people show up and you only have 1 service left, you prioritize serving the veteran. But target, not necessarily, meaning the service coordinator comes in and targets. The service coordinator comes in and say, I'm gonna do Manly Monday meetings. And the men show up and talk about men's issues. And I'm gonna do Teen Tuesdays.
Okay.
And I'm gonna do Wonder Woman Wednesdays, and creative, to engage them and get them involved. But did it say that I'm gonna do, Veteran Fridays? No, but you can do that. The administrative cost portion that the young lady to the left was talking about, or to the right. You can do so many things: transportation, childcare, bus passes, tuition assistance, fixing a windshield. It's for you to be creative with it. You can do so much with your administrative costs. Now, I won't say like so much, you're not getting that much, you're just getting, like a little under 10,000 every year, but it's something and you can do. You can immediately fix a problem rather than you're paying. You're like, okay, go to such and such nonprofit, and 2 weeks later, they would have given her the $250, but you can do it today, so just do it today. So you can hire, administrative staff support is really key, and I tried to sell this one because you may have another staff member in the office that their salary has been locked in from way, way, way back then. But if they provide support in Ross, you can pay them out of Ross. And they're just there, they need a little increase. Basic literacy skills classes, you can even assist with daily living for the elderly and disabled residents that you have. You can be super creative with it. So, any questions about Ross? All right.
I've got a quick question. So the Ross program itself is separate from the salary for the service coordinator.
So the Ross program, the grant award that the applicant wins pays for 3 things. The salary for the service coordinator, up to $72,000 per year. The training and travel for the service coordinator, $2,000. And then the administrative costs and all those wonderful things that you can do, you pay for out of the administrative costs.
Keep in mind that your salary is your salary and fringe benefits.
Yeah.
Not just one person gonna get 72,000. We're gonna give you the salary plus pay all your, the fringe benefit, which is, usually, takes up to 72 when you put all the fringe and, pretty much the salary kind of like 50-ish.
Yeah.
But then all your fringe benefits is the others.
And pay time off.
Pay time off,
and
leave,
stuff comes out of
vacation,
it.
all of that, all your insurance. I know with us, we pay 100% of our employee benefits. Now if their family, they add some family to it, they have to pay. But my housing authority, we pay 100%, which takes up the entire 72. And in some cases, the housing authority do the extra because we do, short-term disability and all of that stuff, all of this stuff. But just keep in mind that the 72,000, because I remember being at one training and we put that out there, that the salary is 72, and one of the young ladies were like, I'm going back because my boss is cheating me. I was like, wait a minute. Remember that it is salary plus fringe.
Yeah.
It was funny.
I've been called.
Oh yeah, absolutely.
So I'm not getting the right amount.
Oh yeah.
Why do you think that? They're like, their check is this. I'm like, no, but remember the benefits too. Like,
Oh yeah.
Just a follow-up question. The $245,000, the award period is for 3 years. So the 245 divided by the 72, then whatever else is left is for the actual program? Is that what we're saying?
pretty much. So 72,000 times 3 is how much?
I think I got it, it's 81,950 for the 72 plus the 25 and the 75.
So
Right,
that
so
80 times
80,
3.
Times 3 is the 245.
So you're saying,
The
after you
actual
take out the
program.
72, you don't think it's that much, is it? Is
For
that
the
what you're
actual
saying?
programming piece, if we're saying these are all the things that we're gonna do, we're gonna donate to the windshield, we're gonna donate to those that need childcare, there's really not a lot. So the person's job is primarily to assist the clients in services that are already existing within their community. Is what it sounds like.
Yeah.
Because what ours do, and just speaking for my housing authority, that's why it all going to depending on how you develop your partners. Because as the coordinator, you're not supposed to deliver any of the services.
Yes.
None of them.
Right.
Not one service is you, the coordinator, supposed to deliver.
Right.
You're supposed to have those partners that you refer them to. And they're gonna get it very few times because, and I say, I work from a small housing authority, but we have that set up, we like, defects, this girl needs childcare.
Right.
Can I get childcare system? They're like, okay, what are we doing? You know, and so it don't have to come out your brain.
Right.
Because they do it.
Right.
So that's the benefit of knowing those resources that are in your community. That's what it's all about. So that your money that you have, yeah, you supplement that, you know, when somebody have a flat tire, need a tire. You know, I remember one girl that I think she needed tires, and so we helped her got those and some things like that. But when you're talking about resources that is readily available in your community, because a lot of times they are available, they just needing the people to come.
Right,
So,
so Ross facilitator, is a facilitator.
Yeah.
A facilitator and a
Right.
catalyst and a case manager.
Yeah.
But, right, no direct
No
services.
direct delivery.
And also a difference with this, you know, and you've spoken that you work with your children. I mean, so I serve everyone with mine. We have 400 units, and it's me, myself, and I. And I'm very dependent on my partners. I could not
Yes, you couldn't do it without
And
them.
we're applying for cores,
Mhm.
and, you know, and we don't technically have enough staff, but we have partner volunteers that are in our building so much that they even cores will consider them staff. Because
They're there all the time.
because we're their site where they offer services and they're in the building enough, and I couldn't do it without them. But so I serve birth through as long as you're there. And so a big part of Ross is serving our, I guess you'd see 62, 50, I include 55, and have them age gracefully in place.
Right.
And so a lot of what I do is socialization and relationships with, because, oh my gosh, Benjamin Barnes the other day, and I went to go talk to him, he's depressed because he says, I used to be such a young thing and now I'm not. Very common right now.
Yeah.
He's feeling isolated. And 3 times, and y'all do this, the best part of the job. 3 times during the conversation, he says, I'm just so happy you're here with me. Right? So with older adults, having them age gracefully in place, it's a great place for them to be. It's a safe place. We bring in through area agency on aging, information about insurance, and really make sure that they know what's going on and that they are safe where they are. But then after school programs,
Right.
we run actually United Way funded program to address summer learning loss for children in poverty, which just gives them more time. So getting them to that our number, I told Beth, I'm not coming on unless one of our priorities is high school graduation, which gets to that initial, 3rd grade reading level, you know,
Yeah.
kindergarten ready first.
Yes.
3rd grade reading level, second, high school graduation, so that they're not gonna apply for an apartment when they're 18, because they're
Right.
towards self-sufficiency.
Right.
And then when somebody has worked really hard their whole lives, and been a rule follower, worked hard, and they make $750 a month in Social Security, and they live in public housing, that we treat them like kings and queens, and make sure that they live safely with us. So ours is just a little bit more of a comprehensive, long-term goal, but because it is all of that, completely dependent on partnership agencies.
I have a question. So, everybody who goes in this Ross program, whatever, that's 5 years.
No, Ross is not for 5
3 years. FSS is 5 years.
No, Ross has no contracted participation.
Okay.
So there is no contract for the residents to sign to say you're working towards these goals. Now, the Ross service coordinator can actually do that with the training and service plan, but it's not a contract. And there is no escrow for Ross.
Right. This is my question I was thinking about. So, if they're in this program, how do you rotate the residents in and out to get the ones that's in continuing and then the ones new that's coming in? That's up into.
Here, with us, we just, if a new person move in today, and they say, because our housing managers introduce it when they doing the orientation, they tell you all about the different programs they have. And then you want to come in. If you want to come in, we're gonna bring you in. So, they have to make sure, we have to make sure we service at least 50 participants per year. But my person case, although she has now, and she only been there since November, but she's awesome.
Okay.
And she already has 76 people.
Okay, so it's not a stop and go thing,
No,
it's a continuation. And if they come in new, they can start wherever y'all at and just keep on
Because
going.
it's their case plan,
Yes.
not ours.
Okay,
It's their
Got it.
service plan.
got it.
So how do we find, since it's open to nonprofits, how do we find a list of Ross recipients of these grants so that we're not overlapping in smaller communities?
You won't be, because the participants to be served are public housing residents.
Right.
So they are overlapping in some sense, but they're not, because remember, this grant is specifically for you. As a matter of fact, the nonprofit that they're really probably thinking of is the housing authority's nonprofit.
Right.
So the housing authority's nonprofit side is the one that actually applies multiple times to maximize the grant to serve their people.
So you can have United Way, you can have, just say Salvation Army, just say you can have it doesn't matter the nonprofit, as long as they will be part of the training
Yes,
for self-sufficient with those residents.
yes.
Right. So there's not a particular nonprofit. I think that's the question she was asking. Are there particular nonprofits that they don't service to?
No, as long as you're a nonprofit and this is pretty much your focus area, I mean, you're not a nonprofit where you rescue stray dogs and then you're going to do social services. You have social services has to be your focus area. You can.
Right. Gotcha.
Another way to answer the 15 minutes?
We have about 20.
20?
May I ask another question about that, Ross, and the nonprofit, because I've never heard that before. And like you said, I mean, you can serve 50, but it's hard to be really comprehensive, because that actually doesn't include people under 18, so anything you're doing with kids is really kind of separate.
Yes.
But, so if you're doing a bang-up job and you've done Ross for a number of years, but really need funding for another person, and I've never heard of the nonprofit angle, but are they more likely to fund a Ross program and say, yes, you need another person, this is obvious, you have 400 units? Or are they, I've never heard of the nonprofit angle before, or are they gonna look at a community where there isn't that service? And who are they funding for that? What nonprofits?
So this is a good question, and you're literally asking the same question. So it's just stated differently.
Yeah.
So how the overlap is, so for traditional public housing developments, now you have an AM and it has an 11-digit PIN code. Under this AM, you can have multiple developments, right? So as long as you have written a development in your application, that development cannot show up into another application to get funded.
Right.
So that's where that eliminates the overlap. So anyone coming in and serving, they can serve any of those development, just not a development that was already funded with another Ross grant.
Right.
Okay?
How do we determine in our radius, let's say, whatever the application dictates, 50 miles, 100 miles, what those other funded organizations?
It's not about mileage,
Okay.
how you determine what the application is proposing to serve is based on your traditional public housing units. So wherever your traditional public housing units are, that's, okay. So say for instance, this is the city, and this is a development, they're a development, you're a development, we're a development over here. It doesn't matter where we are, we all belong to the public housing authority. So if someone puts them in the application and they get awarded, they're done. So no other applicant can come in and propose to serve them anymore because they're over. And someone can do them, and someone can do you, and someone can do us. Restricting at the 1 per public housing authority, 3 per nonprofit. So how do you know? The housing authority always has to write a letter of support to any applicant type to say, we give them authority to apply to serve our people. So the housing authority will always know who is already spoken for. And then they should communicate that to whoever wants to apply on their behalf to make sure they're not already serving a development that's already funded.
Right. So let me ask you this question. So the resident council, we have 6 communities. We have about 569 units. The resident council has to apply for Ross as a whole group, or can they do it for each community?
The resident association forms, they have to have an election and become legally formed, become recognized as a nonprofit at the state level, or if they want to go up to the federal level, that makes them now eligible. They can say, we're going to serve our development, because they're the resident association for that development, and then they can apply. The housing authority still has to give them a letter of support to apply.
But, so they have to do it as a whole, they can't do it as each individual, like I said, 6 communities.
They can only 3 community or 3 resident associations, because a housing authority is capped at having 3 resident associations apply on their behalf. Yeah.
Okay, like the housing authority where I am, we have, rural development, but we also have RAD. So RAD is out altogether. But under the rural development, they have AMP1 and AMP2, and both of those AMP have different resident associations. Both of those resident associations could apply on behalf of the housing authority.
You say rural, so that may be a section 515 and not a traditional public housing. So only traditional public housing qualifies for loss.